How's it going, guys? It is 12:10 a.m., January 22nd here in Japan. And we have a pass-level question for step 1 pathology. Ultra short clip, okay? Nothing lengthy or dramatic, but it's an ultra high yield point that, as I just fucking said, is pass level. So I need to make sure I check the box on this. Before we get started, please subscribe to my channel. Really appreciate it. Give the video a like. Really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. Links to the Telegram group and channel are down below. Now start the clip. 69-year-old man dies in an MVA. Prior to his death, he had 3 months of worsening fatigue and weight loss. An autopsy specimen is shown. Decide to be a partial asshole and not tell you that this is the liver, but I don't think it's overly complicated, okay? Yes, we're looking at a gross specimen of the liver here. Questions asking which of the following is most likely explanation for these findings. Okay, so we have the specimen. You say, not really sure what I'm looking at. Some of you will think this is hyper easy, okay? So it's pass level. So look at the answer choices. Now, we'll go backwards. Choice D, hepatocellular carcinoma is the wrong fucking answer. This is metastases. Now, the way we know that this is metastases is because we have cancer all over the place. That's what these growths are, okay? If we had a primary hepatocellular carcinoma, then we'd have one single lesion with sometimes small satellite lesions next to it, but you wouldn't have the cancer everywhere like you see here, okay? So if you have multiple lesions, you want to think of metastases, but I just issue the mild caveat that if you have a primary hepatocellular carcinoma, yes, you can get tiny little satellite lesions adjacent, a larger lesion, but this is clearly a tumor all over the place. This is Mets, okay? So our answer here is going to be hematogenous spread of colon cancer. Sometimes you'll get the same fucking question, and the answer is just colon cancer, colorectal cancer. You need to know colon spreads to liver via the portal venous system, okay? And real quick, hamartoma tumor syndrome, nonsense answer, okay? So this could refer to P10, hamartoma tumor syndrome, not assessed in USMLE. You need to know hamartomas apply to Peutz-Jeghers syndrome. So Peutz-Jeghers, hamartomatous colonic polyps, and you're going to have perioral melanosis. They'll show you, kid or adult, doesn't matter. I've seen it in adults, where they'll show hyperpigmentation around the lips, okay? Perioral melanosis. So they'll just show you a picture of the lips, and then the answer is hamartomatous. They want to know what kind of polyps you would see if you did a colonoscopy in that patient. Wrong fucking answer. Choice B, focal nodular hyperplasia, wrong answer. Albeit this is asked on surgery forms for 2CK. Weird condition where they're going to tell you that there is an asymptomatic patient who happens to have a CT scan of the abdomen for something else, and they'll say there's a growth seen in the liver with a central scar. And you're like, central scar, what the fuck? They'll mention no history of trauma or anything like that. That's literally what focal nodular hyperplasia is. It's just a benign growth in the liver. Hyperplasia, as the name specifically says here, even though it technically is a type of neoplasia, but it's benign, and it has a central scar, central stellate scar for whatever fucking reason on a CT scan. And 2CK wants you to know that you don't operate, okay? You don't do anything else. You just observe. Wrong fucking answer. Choice A, direct extension of non-hepatic tumor, wrong answer. So it's colon cancer, but you need to know it's hematogenous dissemination via the portal venous circulation, okay? It's not direct extension. Classically, ovarian cancer is direct extension. That's exceedingly high yield. For 2CK in particular, they like telling you omental caking, okay? So that sounds like a colloquialism, but it's on the actual nbme exams. So if they give you some sort of presentation with cancer, gynecologic, you're not sure what's going on, you're like, could this be endometrial? That's extended. I mean, endometrial vaginal bleeding, but my point is, you'll get some sort of nebulous presentation, you're not sure, but they'll mention omental extension of a gynecologic malignancy. That's ovarian cancer, okay? That's classic for a direct extension. In this case, wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.